Bipolar disorder or manic-depressive disorder is a psychiatric condition that results in unpredictable severe mood swings from a high or irritable mood to depressive episodes. It usually affects older teens or young adults, though it can appear at other ages as well. Patients may experience either manic or depressive states or both in the same episode. The symptoms should be present for at least 2 years before the diagnosis of bipolar disorder is made. The following may be noted in the manic phase: increased energy and physical activity, managing with less sleep, increased mental activity, racing of thoughts mania, impaired judgment, abnormal thoughts and paranoid thinking in severe attacks which could lead to suicide or homicide, excessive social extroversion and talkativeness than usual, easy distractibility, feel great about self or irritable, impulsive behavior with excessive indulgence in pleasurable activities and reckless behavior like spending sprees, substance use, or unprotected sex without concern for the consequences. A mild increase in energy and physical activity may occur during hypomania, but hypomania does not affect the social life or work or require hospitalization. The following may be noted in the depressive state: a feeling of low, with an inability to enjoy or take rest in any activity, reduced concentration, inability to take decisions, feeling of being worthless or a continuous feeling of guilt, changes in appetite, weight, sleep, feeling of excessive tiredness, suicidal tendency. The exact cause of bipolar disorder is not known. Levels of brain chemicals, genes, and stress could play a role in its development. Treatment varies with the phase of the illness. Medications that include quetiapine, lithium, sodium valproate, carbamazepine, aripiprazole, azanapine, olanzapine, risperidone, and ziprasidone are used to treat a manic attack. Lithium requires a week or 2 weeks to take effect. Clonazepam or lorazepam may be used in the interim. Medications that include quetiapine, lithium, extended release, olanzapine, risperidone, lamotrigine, aripiprazole, and ziprasidone are used to stabilize the mood and prevent attacks. Quetiapine, lurasidone, olanzapine, and fluoxetine are available for the treatment of the depressive phase. Tips on self-care and management. Consult the doctor and reliable literature to understand bipolar disorder and manage it well. Understand the importance of taking the medications. Medications can put life back in course by reducing the number and severity of the attacks. Keep a journal to record mood, sleep and eating habits, and possible triggers and discuss these with the doctor. Take the medications regularly. Stopping a medicine suddenly could trigger an attack. In case lithium is prescribed, regular monitoring of the blood lithium levels is necessary to prevent toxicity. Stress can trigger a manic or depressive attack. Therefore, avoid stressful situations as far as possible. Take the help of a counselor or a psychologist to deal with stressful situations. The psychologist may suggest cognitive behavioral therapy to deal with bipolar disorder. Psychotherapy reduces relapses, improves the social and work functioning, and the quality of life. Bipolar disorder affects work, and therefore some changes may be necessary. A large amount of work could be overwhelming and trigger an attack. One way to avoid the stress is to divide the work into smaller targets and focus one target at a time. Keep fit and active with regular exercise and activities. Do not remain isolated. It is important to meet close friends regularly or keep busy with volunteer activities. Tips for caregivers, family, friends, co-workers. Dealing with bipolar disorder is a lifelong challenge for the sufferer as well as the immediate family. It can affect relationships with friends and family. Many patients do not take their medications regularly, as a result of which they could suffer from an attack. Ensure that the medications are taken every day. Contact the doctor if the treatment does not produce the desired result. A change in medication may be needed. Since patients may be suicidal or homicidal or may take to drugs or alcohol, they should be regularly observed. Take the patient seriously if there is even a mention of suicide. Remove harmful material from the vicinity and contact for help. Hospitalization may be required if the person may appear dangerous to self or others, or in the case of severe symptoms. Keep a watchful eye during stressful situations or in the presence of any other triggers for a possible attack. The frequent mood changes may make it difficult to maintain a stable relationship. A lot of patience and understanding is required to deal with the patient. Accept that bipolar disorder is a disease over which the patient may not have much control, and the behavior is therefore not the patient's fault. Include the patient in fun activities with family and friends. Engage the patient in activities that are calming. Even as a busy caregiver, take time out for yourself. Join a support group of other caregivers with patients with bipolar disorder to discuss how to deal with various situations.